My name is Cara Fleming. I'm a nurse practitioner at Memorial Sloan Kettering. And this is my first time at JADPRO Live. I'm very excited to be here, and I have a poster that I'm presenting. And the background of my poster is that I work in what's called a symptomatic care clinic, which is an oncology urgent care clinic that we have at Memorial Sloan Kettering, where it's outpatient. So it's an urgent care for outpatient in the ambulatory setting where we deal with acute issues. Another part of my background is that I used to work very specifically with sepsis. So I kind of carry that with me wherever I go. And when I came to this new role in our SCC, what I had seen is over the years, I've been there for about 6 years now, I was noticing that sometimes patients weren't always getting a dose of antibiotics before they were going to be transferred to a local hospital. And that can increase, the delay in antibiotics can potentially increase morbidity and mortality for patients. So it's very important to get those antibiotics in quickly. So that's where I came up with this project. I pulled some data to show that a good number of patients weren't getting antibiotics, and I knew that we could improve that. So I presented that to a multidisciplinary group, and then together we came up with a plan to implement IV push antibiotics as a potential solution. So that's where the poster came about, and that was our intervention, and that was back in 2022. So we had the intervention of implementing IV push antibiotics in our SCC clinics, which are set up throughout New York and New Jersey, 6 different sites around New York City. So it's very exciting to implement this. I definitely use this in my everyday practice. So giving a dose of IV push antibiotics and being able to see patients get them quickly and safely, and then be able to go out the door to a higher level of care was very rewarding. And the results that we saw just from a quick data pull was that there was an increased percentage overall of patients getting antibiotics prior to leaving the site to their hospital transfer. And then we also saw is that there was an overall decrease in the room dwell time, opening up space to serve other patients closer to home. So it was really important for patients to get care close to their home, saving them a trip to the hospital, potentially saving them a trip to the ER, unless of course they're sick enough to need transfer to the hospital. I think it's important to highlight that our specific SCC clinics are AP run. So in my particular site in Bergen County in New Jersey, we've always had APPs as the provider. So I think it's really important to see that APPs are capable and, they play a very important role in this patient care and are able to do this independently. I do hope that APPs and APs in practice in oncology realize that you can notice either a problem or have a solution and present it to your leadership and implement a project that can have lasting impact on patient care. So I encourage everyone to get involved in whatever your passion project is, and really just get out there and not be afraid to step up and speak out about whatever that is for you.